In October 2023, amid the observance of Breast Cancer Awareness Month, Health Minister Moses Javatis announced plans to create a national cancer registry, an information system for the collection, storage, and management of data on cancer patients. While he anticipated the establishment of this registry by the end of the first quarter of 2024, this database has yet to be established. At a recent pre-cabinet presser, the health minister indicated that work continues towards its creation, with anticipation that the cancer registry could become a reality during the next budget cycle.
We started work from the CMO's, the Chief Medical Officer's office, and hopefully this year we will get the budget to actually employ the officers who will form the backbone, so to speak, of the cancer registry. The data collection is very important, and while we do have units that do data collection, it is best practice to have a cancer registry.
The St. Lucia Cancer Society has been a strong advocate for the establishment of a cancer registry. During a recent event to observe World Cancer Day, President Dr. Tamara Remy emphasized the importance of this critical database in the fight against cancer. In addition to offering a clearer overview of cancer rates, a cancer registry plays a vital role in cancer surveillance, providing insight into a nation's progress in reducing the cancer burden.
The cancer registry is very dear to our hearts because you can't do anything unless you have data. You can't ask for grants, and I'm sure you've heard me say this a lot of times. You can't ask for funding, you can't develop policies, everything just seems to be haphazard. So collecting data is one thing, and when we say collecting data, certainly the parts that we have done has been collecting incidents, meaning cases, new cases of cancer.
Apart from providing data about cancer incidents, this database also provides accurate and timely information on treatment and survivorship.
Once you've collected that data, you now need to look at how many of our patients are actually now accessing treatments. What treatments are available? Are the recommended treatments that are, in all the policies and guidelines, do we have them available here? There are guidelines that are somewhat tweaked a little bit more to third world countries, sub-Sahara regions, and they're very much acceptable. We also have to look at survival rates, because at the end of the day, what you're looking at is, yes, you've made a diagnosis, but is your treatment effective? How many people can actually access it, afford it? Is it available? And the most important to me is how many people are surviving. So in 5 years, having been diagnosed, how many people are still alive at 10 years? So the registry really looks at that. It is mandatory if you really want to make a dent in any kind of cancer care that you're offering.
The Ministry of Health is primarily responsible for collecting cancer data and information. However, this task has proven challenging due to resource limitations and competing health priorities. Dr. Remy emphasized the importance of collaboration between the Health Ministry and organizations involved in the fight against cancer, noting that the St. Lucia Cancer Society is ready and willing to assist with the data collection process for this cancer registry.
We have continued to extend our interest, our desire and willingness to assist. As I mentioned before, I personally collect the data myself from the 3 hospitals. I know that some of that data collection is ongoing by the ministry, but it needs to now look like a registry. We will continue to advocate for a registry, and as I've said so many times, I think that has been our biggest contribution to anything related to cancer here in St. Lucia.
Recent data from the Health Ministry indicates that between 2018 and 2024, St. Lucia recorded 1,519 cases of cancer, with women accounting for 820 cases and men 698 cases. Prostate cancer is the most common cancer among men, while breast cancer leads among women. In 2024, the number of cancer-related deaths decreased significantly from 330 in 2023 to 168. While this is comforting, the health minister noted the work to eliminate cancer is far from over. He expressed hope that once established, the cancer registry can serve as a valuable tool for policymakers, guiding the planning and implementation of cancer prevention and control programs.
We are very concerned about the situation with cancer. We are just as concerned as the other jurisdictions in the Caribbean. And if you read the literature in the world, cancer is certainly a very important concern for us in St. Lucia, and we continue to hope that the messages, the education, the awareness, the opportunities for treatment, that we continue to expand those opportunities, and especially early diagnosis, which is where we really want to expand services. This is an area for the expansion of services. We've started with cervical cancer diagnosis, the expansion of that. We've also expanded prostate cancer diagnosis, and very soon we will announce expanded services in breast cancer diagnosis, and so on. So it is a very serious problem, and we are hoping that the cancer registry, the establishment of the registry, will assist greatly.
Jamaica, Barbados, and Trinidad and Tobago are among CARICOM states with a population-based cancer registry. If a registry is established within the given time frame, St. Lucia could become the first OECS territory to have a cancer registry. For the DBS News World, Zane Romulus reporting.